I think, on the assumption that we are going to hit this second wave, it's a really good opportunity for employers to reconsider what they offer from a benefits perspective, perhaps reevaluate their benefits offering in the whole. We've done a huge amount of work recently on a benefits benchmarking survey, which is really trying to find out from employers, what do they do already? How do they sit amongst their peers? And I think that, looking forward, it's really important to make sure that they remain competitive, that the benefits they are offering are in line with what their peers are offering, particularly in such competitive worlds as the financial services sector. From a benefits perspective, offering the right benefits is vital. It will ensure that you have increased productivity amongst your team, particularly if we're talking about well-being benefits, and also to reduce absenteeism, which in turn is going to save employees a huge amount of cost. What I've noticed in recent weeks and recent conversations with employers is that there has been a shift now. So whilst discussions were predominantly based around renewal discussions and premiums, the shift has been to look at organizational well-being as a whole, because benefits actually are just one small component part of that. And I think the most successful employers, if they're looking ahead, will be considering not just the benefits, but what they do around their entire organizational well-being and culture. In the benefit space, particularly two key high-risk areas, one of which is in relation to healthcare. I think the last few months have given employers a little bit of a false sense of security around healthcare. People have been locked down. They haven't been visiting their GPs. They haven't been seeking medical assistance where typically they would have. And that's resulted in low claims. So some of the data we're seeing coming out right now is showing very, very low usage. The industry firmly believes, as do I, that there will be a shift in this and the trend will reverse. And actually the true health fallout from lockdown is probably yet to be seen. So real importance on keeping a close eye on performance and monitoring that. So that's one area. The second area is around employees and working locations. So we've seen, particularly with some of our investment-based clients, where they have employees who are working in the UK, but their home country may be in Europe or around the world, and they've returned to their home country during lockdown. Well, we're starting to get questions already around what is the long-term strategy that employers are going to implement for their working. Can people work remotely, longer term, or even permanently? And this can have a real significant impact on the benefits themselves. So we're saying to employers, keep us informed as things develop. You have to be disclosing this and discussing with insurers to make sure the plans remain fit for